Hi, my name is Joseph Perales. I'm going to talk about refractory associated with Bordetella pertussis infection. Bordetella pertussis is a gram-negative aerobic pathogenic encapsulated coccobacillus of the genus Bordetella, and is a causative agent of pertussis or whooping cough. The bacteria is spread by airborne droplets. Its incubation period is 9 to 10 days, on average, range 6 to 20 days. Humans are the only known receiver of B. pertussis. Now I have a video about this.
Whooping cough is an acute respiratory disease that is caused by the bacterium Bordetella pertussis. Symptoms include severe coughing fits with a characteristic whooping sound followed by vomiting. Whooping cough is highly contagious. It can be spread by airborne droplets containing the bacteria, which are expelled during coughing or sneezing. The bacterial droplets can then be ingested by another person, spreading the infection. The bacteria infect the airways and damage epithelial cells. Some epithelial cells have brush-like cilia that beat in a coordinated fashion. Other epithelial cells, called goblet cells, produce mucus. The mucus forms a blanket over the tips of the cilia. It traps dust, pollen and microbes. The cilia mechanically remove this debris by brushing it up and out of the airways. The pertussis bacteria infiltrate this barrier and attach to the cilia. The bacteria secrete toxins into the area. The toxins spread through the airways, causing the goblet cells and ciliated cells to rupture and die. The bacterial toxins also stimulate the goblet cells to release nitric oxide. This released nitric oxide also damages the cilia, causing them to break. The nitric oxide also causes extrusion, so some of the ciliated cells are forced out of the epithelium. The combination of these effects leads to significant epithelial damage and cilia with confused motion. This hinders the ability to mechanically remove mucus and debris. Mucus is not removed and builds up in the airways. The body attempts to rid itself of this build-up by causing a violent coughing fit. Bacteria containing droplets are released and may infect a new host, beginning the cycle again. Vaccination against diseases such as whooping cough is important for all of us to protect us from the disease itself. It is also important to protect others, such as newborns, who cannot be vaccinated until 2 months of age, or those such as the immunocompromised, who cannot tolerate vaccination.
So, application in medicine. This is a case study about a 66 years old woman with a 2-week history of a dry cough and severe pain in the right flank. 5 days before her presentation, she had received diagnosis of viral upper respiratory tract infection, but her symptoms have not abated with supportive treatment. Physical examination revealed a large ecchymosis across the right flank, and the tenderness on palpation over the chest wall on the right side. The computed tomography of the chest and abdomen revealed a displaced fracture of the lateral aspect of the ninth rib on the right side. Nasopharyngeal culture confirmed infection with Bordetella pertussis. Pertussis is associated with paroxysm cutting, which severe can lead to complications such as rib fractures and injuries to intercostal vessels. So now I have the pros. The pros is that even though if the infection of Bordetella pertussis is highly contagious and it causes dangerous disease, the treatment is rather simple and extremely effective. But the cons is the bacteria is very contagious, spread by flush droplets from one person to another, and the disease is really dangerous, mostly commonly seen in children.
Pertussis is a common bacterial infection that causes symptoms that look like the common cold, which is what makes it very tricky. Most of the time when children have pertussis or any infection like that, we presume it's caused by a virus, not a bacteria. And that's where pertussis can do a lot of its dirty work, because it is a bacteria and it's a deadly bacteria. The groups that we know are most at risk are infants who really don't have much of an immune response to pertussis, the bacteria, at all, and the elderly. The vaccine, which was introduced in the 40s, is about 80% effective, but we still have millions of children dying every year due to pertussis, and it's still one of the top 10 reasons worldwide why children are dying. The symptoms of pertussis are just like a common cold. Usually it begins with maybe sneezing early on, a runny nose, but a runny nose that doesn't go away. We refer to it as the catarrhal phase, and it basically means that it's non-stop runny nose. And that can go on for a week to 10 days, up to 2 weeks. And then the coughing starts. And once the coughing starts, it means that the bacteria has now moved from your nasal passages into the back of your throat and down into your lungs. And you're probably at that point going to develop the pertussis pneumonia. Once the coughing starts, it's where it gets its other name, whooping cough, because people cough and cough and cough and cough and cough. They can't take a break between each cough. And so they cough and then they whoop. It's very contagious. And the reason why pertussis and lots of these infections are still around is that if I had pertussis today, I may not have any symptoms at all. But I shake your hand, you touch your nose, you've infected yourself. And I didn't know I just infected you. We now know that caregivers, grandparents, daycare workers, adults, are the repository. It's where pertussis lives these days. And we infect the babies. And so the movement is to get more adolescents and more adults over 65, up to 65, immunized against pertussis as well. The vaccine is given at 2, 4, and 6 months, again between 15 and 18 months, and again later on around 12 or so. And the reason is the effectiveness of the vaccine goes away over about 3 to 5 years, so you need to get a booster over and over and over.
Treatment.
Right now we treat with antibiotics, and we treat for anywhere from 7 to 14 days depending on which antibiotic we use. The trick with it, though, is you have to take all the doses, like you do with any antibiotic, and even after being treated for 10 to 14 days, however long your doctor prescribes it, you may still be coughing for weeks and weeks and weeks and weeks because of this coughing. So you still may be quite symptomatic even after you've been treated. You're not as contagious after you've been treated, but you, the patient, may still be symptomatic. There's no relationship between the vaccine and autism. What we know is that there have been outbreaks around the country, Washington State, parts of Canada, where pertussis has come back with a vengeance. And most of those cases were among families and cohorts and neighborhoods where kids weren't being vaccinated. So there's still a lot of opposition to the vaccine, but again, it works. It is highly effective. And frankly, once particularly babies get pertussis, we can certainly treat with antibiotics, but there's a small percentage of those kids who will end up in the intensive care unit. And once they end up in the intensive care unit, it really is it's all supportive therapy, and we hope a lot, and frankly we pray a lot, because they are really, really sick.
So this issue applied in Ecuador. Now we can talk about Bordetella pertussis, a common infection agent worldwide. It affects mostly frequently children and all-age patients. In Ecuador, it's rarely common this type of infection because of the environmental factors such as humidity, temperature, and forests are ideal places for the bacteria to reproduce. The conclusion is it's really important to know the signs and symptoms of the kind of the bacteria, so it can be properly managed clinically. Also, it's important to administer the vaccine, tetanus, diphtheria, cellular pertussis. TDP, to limit the infection and prevent it from affecting the children.
Pertussis is a contagious infection caused by the bacteria Bordetella pertussis, which causes violent coughing spells called paroxysms, which make it difficult to breathe. When it's finally possible to breathe in, air is drawn in through partially closed, swollen airways that creates a whooping noise that gives pertussis its other name, whooping cough.
Thanks for watching.